Hi, I'm Johanna Kelsey. I'm the lead radiographer at OneWelbeck Women's Health. We want to offer patients immediate access to breast screening, usually mammography, and then offering ultrasound if they need. But a lot of younger ladies are wanting to come to us for ultrasound as well, so we're offering that. Breast screening is very important because we want to be able to offer it to a wider portion of ladies who don't realise that it's available for them. 40-year-olds and upwards we can offer breast screening to, but it also allows ladies to come to have their mammograms done, and then any abnormalities can be detected sooner rather than later, which just aids any patient's recovery if they do need any kind of intervention, be it benign or anything more serious. With recent work that's been done, we screen ladies between the ages of 40 to 49, and it has been found that it reduces at least 25% of patients dying from breast cancer who would not have had screening. They would have been invited to NHS screening from 50-year-olds and upwards, but it's those younger ladies that we need to try and capture. We're finding with ladies who have been diagnosed earlier, they are still alive, which is wonderful 10 years later after their initial diagnosis, and that's 75% of patients who possibly normally may have passed away because of the disease. So because we're able to offer the mammography or any form of screening earlier, then we are offering those chances of survival. This centre was specifically purpose-built for the breast screening and offering to ladies. We've taken patients at the heart of this to see that their experience is the best. So we want to offer them a nice, relaxed, calming environment for them to walk into. You walk into the main reception and you have a balcony and they're already relaxed, and then we have a separate waiting area which isn't congested. You haven't got the huge waiting times for people to be sitting there and getting worried about what they're going to have. Often ladies with mammograms have heard lots of scare stories about how uncomfortable it is. Often too many ladies don't have their mammogram because they've heard of these stories from various people. So that's always a big worry of mine, that we are missing those patients. So here we wanted to create a much more relaxed, calm atmosphere. I take the ladies into the mammography room and have a really nice relaxed chat with them. We offer 30-minute appointments, so nothing is rushed. You can sit and listen to the patients and their worries and their concerns, show them how the mammography machine works, show them what it does before putting them into the position and bringing the compression down. It's the compression that usually everybody hears about, and all sorts of comments and jokes about it, but we want to sort of alleviate the patient's fears. So when we do the mammography, I try and relax them as much as better. I do a breathing technique. But having relaxed patients actually gives us much better mammography images, which in the end of the day is what we're aiming for, so the doctors can read those images to see if there's any abnormalities. We try to alleviate patients' stress. I'm always here for telephone conversations if patients aren't sure about their appointment when they come, or if they are actually able to have mammograms, because there are a lot of ladies who believe that if they've had implant surgery, if they've had augmentation, that they cannot have mammograms, which they can have mammograms. We just do them in a slightly different way. Again, we take time with those patients, and there's another technique that we can do for the ladies. And again, we offer ultrasound as well when we do ladies with bilateral implants, or implants if it's a unilateral on one side. So we can do mammograms on ladies who have implants, and also with ladies who think that they can't possibly have a mammogram because they're very small-breasted. People believe they're very small-breasted when in fact they might be a cup A or B size. And actually doing the mammogram, we can see all of the breast tissue. It is possible to do that. And then going to the other extreme, who are ladies who are very, very large, they sometimes might feel quite embarrassed to come and have their mammogram, but it is a very, very discreet centre. The room itself is very, very private, and so ladies can have a chat about their worries and their concerns. But literally any lady or gentleman, we can mammogram their breast tissue. It is there to be visualised, so we can do that. The technology that we use here is very exciting because it was the only centre in the UK that has been installed with the Hologic 3D technology, and we offer that to every lady as a routine screening. I know other centres use it as an additional modality, but we here offer it for every lady who comes through our doors for their screening mammogram. So the 3D technology offers the radiologist a much clearer finite image of the breast tissue, and it looks specifically on mammograms from the clavicle, the axilla, all the way down to the patient's chest wall. So we're able to visualise everything very, very clearly, and we then don't need to do additional views on the patient, which can create a greater radiation dose to that patient, which we obviously try to minimise constantly as is. So one of the big questions I'm often asked is when ladies come they've had regular mammograms, or they've had a lot of x-rays, or they've had a lot of CT scans in the past, so they're always worried about the amount of radiation dose that they're receiving. But a mammogram is 0.4 millisieverts, and that's compared to about 7-8 weeks of actual background radiation that we receive walking around London, the streets, the cars, going on a flight across to the Atlantic. Can create more. So the pros and the cons outweigh. So we are always very careful about what we're doing and why we're doing it. But with the latest technology, the mammography equipment is very safe, and we minimise what we're doing to that patient, but always to get the best imaging possible for a diagnosis for that patient. At OneWelbeck in the Women's Health Centre, we have Profound AI installed to work alongside our PACS system, where the mammography images are passed through this computer technology onto our PACS system, which is our picture archiving system, where the radiologist views the images. The AI indicates on the tomosynthesis views that we do on the mammography images that we produce, and the AI indicates any areas of abnormalities or suspicions that the radiologist needs to have a closer look at, or perhaps use another modality, say an ultrasound scan, or take the patient for an MRI scan, for example. When we do a mammogram, the Hologic equipment produces a density reading, and that then enables us to give that information to the patient. We don't know until they do a mammogram if their breasts are dense. So the reading is A, B, C or D. If they're A, they're normal breast tissue, the radiologist is able to visualise their breast tissue on the normal mammogram that we offer. And here at OneWelbeck, the radiologists want to be able to offer a ultrasound if the patient's reading is C or D, because that is giving quite a dense breast tissue. And so the ultrasound will just give that extra little bit of information that the mammogram could possibly miss, because it's quite difficult to read through that dense breast tissue that would show up. So here we want to be able to offer an ultrasound as an additional way of looking at that breast tissue, and just peace of mind for the patient really as well. So we're really promoting that ladies can self-refer from the age of 40 years and upwards for an asymptomatic mammogram. That's if have no symptoms and it's purely just a screening. Just to alleviate their fears, there's this unspoken that people think they can only have mammograms from the age of 50, which is when the NHS are calling patients and inviting them in. But we can offer mammograms from 40 years and upwards, self-referring, or the GPs or their specialists can refer them into us, and that's what we want to promote. With the patients who have had mammograms elsewhere, we can always retrieve those images into our picture archiving system, our PACS system, so that we can build up a history of that patient, because it's always very advisable and best practice to look at the mammograms from previous years to see if any changes have occurred over that time. So a lady who has had mammograms 3, 4, 5 years, we can always retrieve those images to be assessed against the images that we produce here at OneWelbeck. And then we can in turn transfer those images out as well. If a patient feels she needs to go elsewhere, we can transfer them. If a patient wants to carry on with her 3-yearly NHS screening mammograms, that's absolutely fine. We can transfer our mammograms to that NHS institute as well, just so that the patient's sort of keeping in line. And then ladies who have had their screening mammograms and then have had that really worrying recall We can obviously see those patients here as well because we have the surgeons available. We have our radiologists will be here. We can do further assessments on patients who've had a recall. Very often it's just a sort of another few examinations with a mammogram or ultrasound, and a patient fears are alleviated by just having that done, but it's often the wait that they have to endure going back to the NHS. They can come here within a couple of days and have their mammograms or their further assessment done, and it's peace of mind for them. So the mammograms are looked at by our radiologist, who we really try to have a radiologist here on site every day, and when those appointments are made we are ensuring that a radiologist is here, so they will read the images that we produce via the mammography machine, and they are then read those images and the patient can have that report straight away. So it's on the same visit, so they don't have to go home and worry about what the report might say or any anxiety that they can endure, which is just that awful feeling, and they can just have peace of mind on that same visit. Or if the radiologist needs to offer an ultrasound at that same visit as well, then everything can be done on the same day within the same centre.